Turner's a veterinary internist. His wife is a veterinary ophthalmologist. They're in a partnership and a practice together, and he's got some great information we're going to show in a minute. Please, Rob, good to see you. Have a seat. Thank you. Thank you. Dr. Kim Hunter from British Columbia. Dr. Kim is in a mixed animal practice in British Columbia. She has done some wonderful, wonderful research with our creature companions. She's the one whose example you saw with the foal. And she's going to have some wonderful stories to tell us too. Dr. Kim, congratulations. It's so nice to have you here. Please. Dr. Greg Davis. Dr. Davis is from Edmonton, Alberta, Canada. Dr. Davis is in a mixed animal practice in Edmonton, Alberta, and has a lot of great information to share, and we're certainly glad to have you, Dr. Davis. Thank you. Yeah. Dr. Richard Ramsayer. Dr. Ramsayer, DVM, is in a mixed animal practice with his son in Utica, Ohio. Doctor, welcome. Glad to have you. Please have a seat. And finally, from Florida's own, from Fort Lauderdale, Florida, Dr. David Dysart. Dr. Dysart is a small animal practice here in Florida and is also going into mixed animal practice, particularly with horses. Is that right, Dave?
Thank you for all being here and for supporting this. It's been a dream of mine to get this word out to the veterinarian animal community. Just for a show of hands, how many people have the best dog in the world? No, you're looking at him right here. This is Buddy. Buddy is one of my own dogs, and actually our whole journey in Nikken started with my wife, Stephanie, who's a board-certified veterinary ophthalmologist. She injured her back, and 13 years of university training, a year and a half into our practice, she couldn't work anymore. And we tried everything that was everything, and nothing was really helping her. And along came an innocuous-looking little magnetic flex pad. Anybody ever seen one of those? The guy that loaned it to her, she looked at him like he was eating live spiders, like, why would this work for me? And she had one of those miraculous experiences, and in 15 minutes her back stopped hurting for the first time in a year. And how many of you folks thought that might be something like the placebo effect? Yeah, that's what I thought. That went over like a turd in a punch bowl at my house, I'll tell you. What we did was soon into that, our little dog, a Cavalier King Charles Spaniel, had a disc rupture in her back. It must be genetic. She got it from Steph, and she had spinal surgery performed, and she did really well with that. But after having the surgery, she would have other discs in her back that would give her an equal amount of grief, not quite severe enough to require surgery. And we'd put her on medication, and she would get a side effect from that. And we'd put her on medication for that. She'd get a side effect for that. Both of those side effects caused us to get the carpets cleaned in the house, and then we'd start all over again. And a year into this was when Nikken came along. So we put a little magnetic device, a little mini, on her chest harness between her spine in the middle of one of her events. And an hour later, she jumped up from the floor onto my lap with absolutely no discomfort in her back. And we never took that off for the next 4.5 years, and she never had another problem. And that's when I understood that we really have a hold of something powerful here. Thank you. This is her older brother, Buddy, and Buddy at this time was a 14-year-old mixed breed dog, and he's 15. He's going on 15 now. About a year ago, he had a problem called acute geriatric vestibular disease, and that means that he lost his balance, and severely so. And so, can I have the next slide, please? A close-up of Buddy. That's Buddy. And actually, if you look, he's got a little bit of a head tilt here. His head's tilted a little bit to the right. Can I have the next slide, please? These are the thermographic images that Curtis Bennett, and Curtis Bennett is just doing a marvelous work with Nikken, and I'd like to acknowledge him for what he's doing. The image on the left, you can see that Buddy's head tilt is to the right, and at the base of the right ear is the vestibular apparatus, or the area of balance in the body. And we have for years suspected that this condition in dogs is a vascular problem, a blood flow problem to that area of the brain. And if you look, you can see that the area around the right side of his skull is darker blue. And if you look on the thermal scale on the side, that's colder. So there's less blood flow going into that part of his head. We used a device called the Palm Mag, which is a biaxial magnetic rotation device that Nikken has. And after 11 minutes, the images on the right were generated. And can you see that area of his head has equalized, that the heat is now the same on both sides. But he seeks out the Palm Mag. He looks for it, and he likes to lay his head up against it when it's running. This is much more complicated than just increasing blood flow or decreasing blood flow. Can I have the next slide, please? This is a picture of Buddy's butt. Sorry, if you're Canadian, that's his bum. Okay. And if you look, this is, on the other end, he had a very common problem. This is called a hot spot. And right over his right hip, he was chewing at himself. And can you see that little red dot at the arrow on the left side where it's very, very hot? Same thing. We used the palm mag for 10 minutes, and can you see where that area has cooled down significantly? So in his head, the area cooled, the area warmed up, and in his butt, the area calmed down. That's not a medical claim. It's not going to make your butt cooler if that's a problem with you. So what we have a hold of here is something that balances the body. It's not about pushing the body towards something. It's about balancing it back towards center. And that, I think, is one of the things that makes this such a phenomenal technology. Kim has some excellent slides to show you as well. Thank you very much.
I would like to, again, acknowledge Curtis for making this possible. I have some images as well, but first I'd like to tell you a little bit about myself. I'm a veterinarian of 24 years, and about 10 years into practice, I knew I needed to make a change. I watched some of my colleagues retire and sell their clinics only to go and have to work for somebody to put extra money aside for retirement. I could see myself following the same path, and I knew I didn't want that. I had to do something different. I got into Nikken by accident. I went to a wellness preview as a favor to a friend just to be an extra body. Well, we were the only two bodies there, so I couldn't sneak out. But I was open-minded. I'd been trained in acupuncture, and so I listened. And the facts about the health industry were new to me, and they really rang true. And the MagStep test really impressed me. So I left there, and I kind of forgot about it, but I did sign up, and I was a paper distributor for months. A few months later, I went to another wellness preview. There must have been 50 people there, and so many of them stood up and said what these technologies had done for them. It really moved me. And so I started to help a few dogs, and then I started to help a few people. And then I found, when I tried it on myself, although I thought I was healthy, 18 years of chronic back agony disappeared. Wrist problems that were causing me to drop instruments disappeared. And I knew in my heart this was going to be really big. So for those of you who want to talk to their veterinarians, find out what their need is. And they're just people too. So now I'll show you my favorite images here. This is Jenny. Jenny's a 10-year-old border collie, and she came to me with a right-sided nasal discharge. And we did a number of tests on Jenny, a nasal flush, blood test, x-rays. Nothing was really conclusive. And that sort of exhausted what we had available for tests in our clinic. So we treated her medically for a couple of months, many different medications, and there was no response. But during that time, she remained lively and shiny, and her body weight was good. So although I was worried about cancer, I wasn't at the top of the list.